Dr. Kevin Ende discussing hairline lowering surgery and the frequently asked questions. One of the questions that I get quite often is, can hairline lowering surgery be performed on men? The simple answer is yes, and I have performed hairline lowering surgery on men many times in my practice. In fact, it's about 30% of the patients undergoing hairline lowering surgery are men in my practice. Now, there are other factors to consider when considering hairline lowering surgery in young men, middle-aged men, or older men, in that we don't know the final pattern of their hair loss. It is very likely that a man will lose hair along the hairline, and unfortunately, even though the scar does heal quite well, in some patients the scar would become visible if that patient continued to lose hair later in life, 5, 10, 15, 20 years down the road. If this was the case, we do discuss ahead of time that hair transplant surgery can be performed, whereby we would take hair from the back of the head and transplant it back to the hairline to cover up the scar. And this usually makes it, again, imperceptible, just as it was after the original procedure. Just to see how imperceptible this scar can be, I do have pictures on the website of a man before and after hairline lowering surgery, and I use a comb and pull back as much as I can to show you that even with the hair pulled all the way up, you really can't see the scar. And I have many examples from all the different angles of this patient so that you can see how the scar healed.